Hey guys, welcome to the LabMate channel. I hope you guys had a great holiday season, and I'm glad that you guys are here with LabMate to do some more learning. Today we're going to be looking at another microbiology case study. If you guys want to look at the question ahead, you can go ahead and pause the video and go into the description below, where I'm going to have the questions written out as I've received them, and then we can pause the video, and then once you've done that work, you guys can play the video again and we can go through the case study together. Because today we're looking at a case study of a 3-week-old male patient that has seizures, but this is part of a microbiology question paper. Okay guys, so let's get to it. So looking at our case overview, we have a 3-week-old male patient that was born at term via cesarean section. This patient has developed abnormal anterior fontanelles, increased respiratory and heart rate, and has developed seizures. Their doctor suspects a neonatal sepsis or meningitis, so the lab tests that are done is microscopy of the cerebrospinal fluid. So let's look at the microscopy findings. So these findings include a wet mount plus a gram stain. So for the wet mount, we found leukocytes, which is about 4,000 per nanoliters, with 92% of them being neutrophils. And the gram stain found gram-positive cocci. So let's get to answering our questions. So the first question is basically, what is the most likely organism that is causing this infection? So most likely it's going to be group B, Streptococcus. Specifically Streptococcus galactae. Don't mind my pronunciation. So the reasoning behind this answer is that gram-positive Streptococcus is a common cause of neonatal sepsis, particularly in infants younger than 3 months. It is a gram-positive cocci, often appearing in chains or even pairs, and it is typically transmitted during delivery, even in situations where there's a C-section, but especially if the maternal colonization or rupture of membranes has occurred. So we're looking at this image here that we have of the group B Streptococcus. So next, the question is, what other organisms have similar gram stain morphology, right? So we're going to look at Streptococcus pneumoniae first, which has a distinguishing feature of diplococci that are lancet-shaped. It's optokin sensitive and biosoluble. The clinical relevance is that it causes meningitis in infants, but is less common in neonates compared to group B Streptococcus. Another option is Staphylococcus aureus, which is distinguishing feature is that it's in clusters of cocci. It is catalase positive and coagulase positive. The clinical relevance is that it can cause sepsis and meningitis in neonates, but again, less common than group B Streptococcus. Another one, and our final option, is going to be Enterococcus species, including Enterococcus faecalis and faecium, which have a distinguishing feature of cocci in pairs or short chains, bile-esculin positive, and the clinical relevance is that they are opportunistic pathogen, and again, less common in neonates. All our final question is explain one key virulence factor produced by the infecting organism. So we said that basically we're looking at the key factor of Streptococcus elegectae is polysaccharide capsule. So the function is that the capsule prevents phagocytosis by neutrophils and macrophages. Remember the findings with the microscopy? It contains sialic acid, which inhibits activation of the complement pathway, allowing the bacteria to evade the immune system, which is not good for our patient. So the impact this is going to have is quite serious, because for neonates, their immune systems are quite immature, so leading to like this infection being quite serious. So our final notes that we're just going to add is that given the symptoms of the increased respiratory and heart rates, seizures, and the lab findings, group B Streptococcus is our suspect, right? And to have a more definitive diagnosis, you'd have to do a culture, okay, with further confirmatory tests such as a CAMP test or PCR. If you guys want to learn more about tests such as the CAMP test or about catalase and whatnot, you guys can check out the LabMate blog, where you guys can go through and find those tests and discuss it and tell you how to perform it and everything. You guys can go check that out. If you guys enjoyed this video, leave a like, share it with your classmates, and don't forget to subscribe. If you guys have any questions, guys